You know, in medicine, a really complex situation can sometimes boil down to just one single critical number. Today, we're going to talk about the number, the one that tells you a patient is in very, very deep trouble.
So what is it? What's that one reading on the monitor that basically screams that a patient's body is tipping over the edge? You know, going from just coping with a crisis to completely succumbing to it.
And there it is, less than 90. We're talking specifically about a systolic blood pressure that's dropped below 90 millimeters of mercury. And let me tell you, this is way more than just a low number. It's a massive distress signal coming from deep within the body's core systems.
Okay, so seeing that systolic pressure dip below 90, that is one of the most classic, tried and true alarm bells in all of medicine. It's a clear, unmistakable sign that you've just crossed a very, very dangerous threshold.
So what this really means, the bottom line, is that the body just can't push enough oxygen-rich blood around anymore. It can't maintain perfusion, as we call it. And that means the organs that absolutely matter most, the brain, the heart, the kidneys, they're being starved. The whole system is starting to fail.
Now, this state of failure, it actually has a specific clinical name. It's the technical term for that exact moment when the body's internal battle is officially lost, when it flips from coping with the problem to crashing from it.
We call this decompensated shock. Think of it like this, right? Your body has all these built-in emergency systems. It can speed up the heart, it can tighten up blood vessels to try and keep the pressure up. But in decompensated shock, those systems are just done. They're completely overwhelmed, totally exhausted. They've given it everything they've got, and it's just not enough anymore.
This really frames the whole shock spectrum perfectly. On one side, you've got compensated shock. That's where the body is still actively fighting back. The pressure might be a little low, sure, but the system is holding on. But on the other side, in decompensated shock, well, that fight's over. The body is failing, and the pressure just plummets.
But listen, this is so much more than a number on a screen. This state of collapse has real, tangible signs that you can see and feel right there at the bedside. So what does this actually look like in a real patient?
You can literally see the domino effect happening. Because there's not enough blood flow, the brain doesn't get enough oxygen, and that leads to confusion. You try to feel for a pulse at the wrist, and it's either super weak or it's just gone because the pressure is too low. The skin gets all cool and clammy because the body is shunting blood away from the surface to try and save the core. It's a complete picture of impending collapse.
Okay, so we see the signs. We know our patient is decompensating. The next critical question is, why is this happening? And there are usually 4 main pathways that can lead to this state of shock.
So you've got to start thinking like a detective, right? Is the patient bleeding out? Is there just not enough volume in the tank? That's hemorrhagic shock. Or is it a leaky pipes problem, like in sepsis, where a massive infection makes all the blood vessels lose their tone? Maybe it's a pump failure. The heart itself is the problem. That's cardiogenic shock. And finally, could there be a physical blockage somewhere, like a huge clot in the lungs stopping blood flow? That's obstructive shock.
So after looking at all the mechanisms and the possible causes, it really all comes back to that one single, unmistakable sign. The one bottom line that just cuts through all the noise. Just let this sink in for a second. A systolic blood pressure below 90 is decompensation. It's not a warning sign that it might happen, it's the sign that it is happening right now.
And please, if you only take away one thing, let it be this. This is a late sign. The body has already been fighting and losing for some time before you see this number. It means you're already behind the 8 ball and the clock is ticking. This patient needs immediate, aggressive intervention.
So, it all comes down to this. Recognizing the number is just the first step. The real question is, you see it. So now what? What are you going to do about it right now?